right now.
Thank you, everybody. Sorry about the little break. So we're gonna have Jen walk us through if we made any changes we may have made. And ask any questions we want to ask.
Well, good afternoon. For the record, Jen Carvey from the Office of Legislative Counsel. I don't believe I have been with you on this bill since I did your initial walkthrough. So if you have changes you want to make, I need to know about.
I have just failed miserably. I'm not even going off the record to say this. I believe, well, we can discuss it as a committee and then maybe we can insert it if the consensus of the committee is that we'll add it. And I don't think it will take very long, but and then maybe we'll take a short break. But so we've made no changes. You want to put the bill up so we can see it? And I think I'm referring to the ability for this to be applied to deductible.
Gotcha.
And I think we had language that was presented to us around that.
I think I did look at some of what you had submitted to you, and I think the recommendation, I'll look over to Healthcare Advocate's office, was language similar to what had been in 202 last year. That would give some clarification around cash price.
Yeah. And so let's just refresh ourselves on the bill and then we can look at that language and see. Okay.
Great. So this is an act relating to establishing the Vermont Prescription Drug Discount Card Program. It adds a new subchapter in Title 18 and a chapter on prescription drug cost containment. Creating this program be administered by the Office of the State Treasurer, and the purpose is to pool prescription drug purchasing power with other U.S. states and territories and non-governmental organizations. And the program would be available to all Vermont residents. It allows the Treasurer to cooperate with other U.S. states and territories, regional consortia, or non-governmental organizations, or a combination of them, to pool prescription drug purchasing power, to reduce prescription drug costs, negotiate discounts with manufacturers, centralize purchasing, and establish volume discount contracting. And then it defines volume discount contracting as the negotiated purchase of a large quantity of a prescription drug at a decreased cost. It allows the Treasurer to require reasonable fees to be charged to defray program costs, and it notwithstands the statutory provision that says only the legislature can set fee amounts, to allow the Treasurer to determine the amount and method of collection of any fee based on actual costs. Starting on January 15th, 2028, and annually thereafter, the Treasurer would report to this committee, Senate Health and Welfare, and the Governor on the activities of the program during the previous calendar year, including how many Vermont residents and pharmacies participated in it and the amount of savings on prescription drug costs that was achieved. It establishes a fund, the Vermont Prescription Drug Discount Card Program Fund, as a special fund to be administered by the Treasurer to support the program. The fund would consist of any monies appropriated to it by the General Assembly or transferred to it from the federal government, other state agencies, or other government source, any monies from the payment of fees or other monies due to the program, and any gifts, grants, or donations made or received by the Treasurer for the program. Basically, anybody who wants to give him money, it will take.
And he's got a bank account to put it into.
The directs the Treasurer to credit all interest earned on the fund on fund balances to the fund, as well as any other income derived from the deposit and investment of monies in the fund. And it keeps the money in the fund that remains at the end of a fiscal year. Section 2 is a report. By January 15th of next year, the Treasurer would report to the General Assembly on implementation of the program, including any recommendations for improving administration of the program, any fees to be charged to participants, and an estimate of the projected cost to the state in the event additional financial support is necessary to administer the program. Section 3 is what will send the bill to the Appropriations Committee before it goes to the floor. So this would have in fiscal year 2027, the sum of $50,000 appropriated from the general fund to the treasurer's office for the costs of developing and implementing the program as set forth in this act. And the act would take effect on July 1st of 2026.
Right. Any questions?
I-
Yeah, go ahead.
I just gotta, I don't know. Can't explain it. Two things. We've allowed any monies, fees, everything to go back into the program. And I don't expect this, but what if it becomes a large sum of money?
Well, you can, I mean, one of the things, you're getting an annual report on the program, so you could always change
Okay, so we could.
the amount, you could,
Okay.
yes, you could limit the amount that could be carried over from year to year.
So should we get a report?
You are getting, a
Yeah.
Okay.
Yep, you got an implementation report and then you got an annual report
Annual
starting in
report, okay.
2028.
My
Yeah.
other question, concern, because I'm here to represent Vermont.
Yep.
And I believe it said that anybody gives a address and a,
Says it's made available to all Vermont residents.
okay. What, didn't they tell us the other day that this could go to anybody from,
If you had a Vermont address.
okay, so my brother in California can give a Vermont address and his birthday, and he'd be eligible for this card.
Well, the program is available to all Vermont residents, so it will be up to the treasurer's office to determine who is a Vermont resident.
I think he told us that, did he, do I remember hearing that a birthday and a address was sufficient to be on this program?
Yes.
But the program, I mean, when somebody, it's my understanding, when somebody uses this card, it doesn't cost the state for them to use
I
the
do
card.
understand
So if
that.
it's issued to somebody who lives in California and
Yeah.
used your
Well,
address, I'm not sure there's a quantifiable.
It really isn't, but it's a little, I guess, a pet peeve of mine that somebody from Canada could do.
Well.
So,
Probably had cheaper prescription drugs in their own country.
They need it.
No, but that's the point. It's just the fact, when people know about this and
Yeah.
it's out there.
Well, so right now, anybody with a Washington address can use it. Anybody with an Oregon address can use it. Anybody with a Nevada address can use it.
Connecticut, right?
Connecticut can use it.
This says a Vermont resident,
Yes.
but it's an address considered a resident.
For the purposes of this program,
Yeah,
I
that's
believe
what
the treasurer said that
It's
address.
not gonna stop me, but
Okay.
it's a concern.
Okay,
So
all right.
nobody else feels that
Frankly, the
way.
more people that use it,
Yeah,
Bigger your volume.
I understand.
theoretically, the lower it would be for
Yeah.
everyone. Yeah.
Does it have to be a physical address? It can't be a PO box?
It will be up to the way the treasurer's office implements it. The language of the statute says it will be made available to all Vermont residents.
They don't usually take a PO box for any.
And that's the answer to the question.
Okay.
You can-
Well, if we stick to that, Vermont resident, to me, a Vermont resident means living here, not using my address.
Well, what about, like, if I go down to Florida for 5 months of the year?
You still, unless you declare yourself a Florida resident, you're still a Vermont resident. You're here.
I mean, this does not include a definition of Vermont resident, which we do use in some places, which is generally some version of being domiciled here with an intent to return here, coupled with an intent to return here if temporarily absent and acts consistent with that intent. But I don't know how I don't know if the treasurer's office is capable of that level of investigation on each.
If we could make it simpler. It's okay.
Wendy,
I just have a question. If someone did get this card, it can only be used in the states that have this plan, correct? I can't use my card and go to Florida and say, honor this card.
I think it has to do with participating pharmacies.
Yep.
Um,
the pharmacies choose to
Pharmacies,
participate
okay.
in this.
Okay. But it's not taking anything away from anybody else for somebody that may not be a resident. Like, it doesn't.
Not that I can see.
I'm aware of.
See, it's just easier to put it in the beginning and try to take care of it later on. So, but I'm okay with it.
Hopefully more states will get into this and everybody can use wherever they are and it won't matter. So,
Another concern.
yeah,
The state of Connecticut's only got 23,000 participants. That's not very big.
I think,
So when we say hopefully all the states do this, that's going to be a long time coming.
I think their comptroller indicated that that their uptick, that they were hoping to see more uptick. And they are going to, I think he said that they are looking to do some advertising around it too. That the uptick has not happened because people aren't aware, and this is why the treasurer has this $50,000 in there
Yeah.
to make sure that Vermont residents know.
And my last concern, go ahead.
And
And
AARP came in and said, we will help promote it, and I think there's been other folks that have said they'll help promote it.
My last concern, I'm reporting it, so I'm okay with it. But I'd like to,
So we're.
I'd like
You're
to-
gonna ask yourself a lot.
I'd like these answered, okay? To me, it's going to be very confusing to a lot of people going to the drugstore. In other words, you're going to be in a drugstore and there's people behind you and you're going to say, oh, what's my best way to pay for this? Cash or this card or my insurance card? The people that I know at home, they're not going to care.
Cool.
They're going to throw their insurance card out there and that's the end of it. How many people are going to go on there?
That's their choice.
Yeah, I know, but it's going to be confusing.
Go ahead.
But just that, I think if that's the case, then maybe we and our colleagues have a duty to educate our constituents about how to maximize the benefits of this program. And just the message being, you want to save money, this is a way to save it. Say to your pharmacist, what's the cheapest way? It takes like 5 seconds. $5, $10, this, okay. I think where it's confusing is how it applies to your deductible or not. And I would say have them call the healthcare advocate and work that out in advance. And call their office up because they're really good at that stuff. They're really good at helping people save money.
Still confusing.
The whole system is. Sorry.
You know what I'm gonna
I
do?
hear ya.
I'm gonna come up to Montgomery and I'm gonna help you use it.
Yeah.
Go ahead, Daisy.
Penny, what is your number one goal this session?
Healthcare affordability.
Okay.
Okay, listen, I'm reporting the bill, but I got concerns of all the bills.
And you should, and I think it's good to ask the questions, but like, I feel very strongly that this is critical for healthcare affordability for folks. If there's one chance that I can get my prescriptions, because I am on a lot of prescriptions at a lower cost, like I'm gonna take it, I'm gonna figure it out. And it's not like I'm getting a new prescription every month. Like once I'm on something, I'm on it for a while. So I'm gonna figure out
It'll
which
work
card
out.
is the lowest cost, and I only have to do that once.
I'm looking back at the treasurer's testimony. And I can't remember, but I do think he made an estimate that it's in the millions of dollars that it could save.
We have a representative.
Are there any? Yes. I can't remember the number, but is there an estimate of if we have sufficient uptick in this that?
I don't remember the exact number, but it is up to like a few million on behalf of all.
Yeah.
You know, participants, if you get a good rate of uptake, yeah.
That's-
Sorry.
No, I was just gonna say, that's millions of dollars that stays in our constituents' pockets.
And the other thing is, there are several of these cards that are already out there that people can take advantage of.
Be like this, people with credit cards. Which one?
Exactly, yeah.
Well, then they can comparison shop. And as we learned from the treasurer, this is nonprofit. And it also does not sell your data, which cannot be said for a lot of the other prescription drug cards out there. Any other questions on this? Thank you for your,
Thank you.
You're gonna put that.
yes, so all questions answered, Alan?
Yes.
Okay. So I believe in Charlie Becker's testimony. He had requested language around putting in, inserting into this bill to ensure that this will be applied, that people can, and we heard Blue Cross say they do this all the time, that you could, if you wish, you can submit a claim to your insurance and it will be applied to your deductible so you're meeting like your out-of-pocket max or your deductible amounts. Is everyone in favor of inserting that language into the bill?
Yep.
Yes. Okay, all right. So Jen will have to do a new draft.
You also want me to
And actually, I'm looking at some language because I think we may need to put it in two places and I'm not sure I appreciated that.
Right? Do you need time? You're gonna need time.
Time, but you're taking some testimony
Yeah,
this afternoon
yeah,
that I was gonna be here just to listen to.
okay.
So I can work on it during that.
So, let's see. We don't have our next witnesses until 2:00. I think I'm just gonna. I think I'm gonna take a break until Jen either finishes or until 2:00. Our next witnesses are not here yet.
It won't be long, right?
They're scheduled at 2:00.
Okay.
Okay?
So we could have a break from 5 to 30 minutes, depending on when Jen finishes.
Yes.
Okay.
No pressure.
So, yeah.
Should I go try and find?
Sorry, I didn't mean it that
I
way.
mean, those scans, the nurse anesthetist, and they maybe just.
You go back to.
Yeah, let's go off of live and